Good afternoon. I'm Dr. Michael Tapper from Lenox Hill Hospital in New York City, reporting to you today from Boston, Massachusetts, where the conference on retroviruses and opportunistic infections is about to begin. Now, although this conference traditionally has dealt principally with HIV disease and its complications, the organizers have chosen to expand it into a number of other viral diseases. In past years, we've heard a great deal about hepatitis C and hepatitis B. And this year, we actually got to have a very important follow-up on Ebola disease, something that's still very fresh in the mind of all physicians in the world, including physicians in the United States. I am particularly proud to be joined by Dr. Daouda Sissoko from Guinea, University of Bordeaux in France, and Guinea-Conakry, who will be doing a presentation here as a follow-up to the situation in Guinea.
Yeah, thank you very much, Doctor. I'm Dr. Daouda Sissoko from French National Institute of Medical Research, and now I'm deployed in Conakry since April 2014 to help the Guinean government to deal with Ebola outbreak.
So what will you be presenting here? I mean, we're all very familiar with the Ebola situation as it has evolved, and we continue to have sporadic cases showing up in some of the countries, although officially all the countries have declared Ebola eradicated, but we get occasional cases. What will you be talking about at this conference?
I will talk about the dynamics of Ebola arena on a semaine from mal survivor. As you know, you are very concerned by the sexual transmission of Ebola due to the occurrence of two sexual transmission cases in Liberia and one in Sierra Leone after the control of this outbreak. That is very, very concerning. That is why you are working on this topic.
This is becoming an interesting theme because the current virus that we're all worried about right now in the United States is Zika, and of course, which also originated in Uganda probably, and we've also heard reports about the potential sexual transmission of Zika. These are things we haven't thought about. We thought once you were over the disease, you were over it. That turns out not to be exactly the case, and this issue of transmission between partners, I think, is a critical issue as we learn more and more about viral diseases. I think the other question I would ask you is it really gone from West Africa? Because we've had periodic outbreaks in Congo, in Uganda, and I guess the reservoir, while it's not certain where the reservoir is, the reservoir probably remains somewhat in animals, not sure which one. Is there still concern about another recurrence of Ebola in West Africa?
Yeah, you are very concerned about the natural reservoir with an animal world, in a zootic world, but as the epidemic is very recent, we are very concerned by the reservoir among male survivors. What you see in our study is that up to 10% of male survivors can share the virus in their sperm until up to 11 months after the disease onset. We are still following them, and you will know in the future how long this survivor can share the virus in their semen. That is a very, very important topic because this might be a source of a new outbreak.
It certainly could be the source of one of these sporadic cases that we've heard about as well. So that's an alarming story and something we have to continue to bear in mind because I think we all feel that there's always the potential for another outbreak. Exactly. I wanted to ask you also, the outbreak I think was so devastating when it first began in Liberia and Sierra Leone and other countries because of the lack of good infection control practice in these countries. Have the countries of West Africa that were involved learned the lessons from the last time around?
I'm very worried about what you are seeing. There were a lot of intervention, a lot of training. My guess is that is not sufficient to change the mind. I think it's kind of a cultural practice among the doctors who still are not very, very, very concerned by the infection control. In my point of view, there are a lot of workload, so they forget the most important thing is the prevention. And for me, you have a lot of job to do again on infection control within hospitals.
So the epidemic had a devastating impact on the healthcare workforce in all of the countries that was involved. Many doctors, many nurses, including volunteers from the United States, died from Ebola. I hope that WHO and the various countries that have helped, Great Britain and France, will maintain the concentration on infection control. Médecins Sans Frontières is still working there.
And the national authority too has to emphasize this point to prevent the transmission of infection within their hospitals, within their healthcare center. That is very important. We saw with HIV, with hepatitis B, hepatitis C, that a lot of persons are contracted the disease within this hospital. It's not acceptable.
Very, very important lessons, not just for the countries of West Africa, but for the whole world.
Exactly. Thank you very much, Doctor.
Thank you very much.
It was my pleasure to meet you. Thank you very much.